Hi, I'm Dr. Puneet Gupta from the Hunar clinic. I'm here to answer your questions by means of this short video. Hopefully you'll find it useful. Thank you. One question that I'm often being asked is, what is the best type of liposuction for lipodema patients? I can answer this based on my own personal experience and knowledge, having worked with lipodema patients for more than 10 years. Before we decide what is the best treatment for liposuction, we must understand some of the challenges that you have in treating a patient with lipodema. It often means there is a huge fatty pocket to be removed. So that has a huge consideration as to what is the safest way of removing the fat. And also it is lipodema, it's not lymphedema for most patients, which means their lymphatic system is completely working as normal. And research have shown that lipodema patients are at risk of developing lymphedema in the future. So what does that mean? We want to preserve their lymphatic system as best as possible. And I think that narrows it down to what should be the right treatment for lipodema patients. We do not want to use big bore instruments because they are more likely to damage lymphatic system and very hard to predict what the long-term prognosis could be for those patients. So you don't want to use large bore instruments because they are more likely to damage the lymphatic system during the procedure, making long-term prognosis very uncertain as to what can happen a few years down the line. Or you can choose to have finer instruments which will preserve the integrity of lymphatic system whilst removing the fat, and you can be sure that long-term no damage has been done to the lymphatic system. Another important consideration is to avoid energy-assisted liposuction. What do we mean by that? Energy-assisted liposuctions mean you use some form of external energy like laser, ultrasound, radio frequency, or any other form to actually heat and melt the fat. Now, although these methods are effective, they do the job, but I would say on the side of caution, they probably work better for smaller cosmetic liposuctions. If you're trying to remove a large volume of fat or a big pocket of fat, like in lipodema, then you're increasing your risks of complications, which could be skin burns due to just the contact time of these hot cannulas inside the skin because you have to remove so much. So that puts you at increased risk of skin burns. It can damage the undersurface of skin, leading to seromas, unsightly dips because the fat can be removed too quickly from certain areas. So in a nutshell, my preferred method to go to not big bore instruments or energy assisted, but microcannulas using fine instruments without connected to any forms of heating or energy, take the fat out without causing unnecessary complications. Recovery is faster and the results are much more natural. Thank you.